Are you having any difficulty in getting pregnant? You have tried IVF several times and your IVF has failed. You have some problems related to the uterus. That is the reason why you're not getting pregnant. You have problems with your egg quality, and that's the reason for your difficulty in getting pregnant.
Environ Life Science Limited, partnering for life.
Hello, I am Dr. Sweta Agarwal. I am the main consultant gynecologist and infertility specialist, laparoscopic and hysteroscopic surgeon at Southern Gem Hospital in Hyderabad, located in Bashir and Banjara Hills. With my background, I have worked in Australia for 7 years, where I was trained in infertility work as well as the hysteroscopic and laparoscopic surgeries, and we've been doing this work since last 20 years. You have been trying for infertility treatments and have been through a number of IVF cycles and you have been unsuccessful, then we are the right person to get in touch with. There are a number of reasons why your IVF would have failed. So I would recommend first we need to evaluate what is the reason behind this failed IVF. Sometimes we may be able to find an answer. Sometimes we may not be able to find an answer for this. Most often, whenever an IVF has failed, it could be because either there is a problem with the uterus or there is some problem with the embryo or a problem with the egg or with the problem with the sperm. So we need to look at the various levels and identify the underlying cause. Talking about the uterus, it could be there must be a septum or a polyp or a submucous fibroid within the uterus need to be ruled out. For this, we recommend a 3D ultrasound and also we recommend a hysteroscopy. Hysteroscopy is a very simple procedure which we normally do under a short general anesthesia. We put a small camera inside the uterus and look at the uterus from inside and correct any adhesions or any polyps or any septum inside the uterus. Once we've corrected this, your chances of getting pregnant will be very much increased. Sometimes there can be problem beyond the uterus, which is in the embryo. As we know, embryo is generated with the egg and the sperm. So it could be because of poor egg quality, the embryo is not very good, or sometimes because of the poor sperm quality, the embryo may not be very good. For this, what we do is a special test for the embryo, which is called as a pre-implantation genetic testing, where we take a few cells from the embryo, which is developed after up to a day 5 stage, and take a few cells and check for the karyotype or the genetic status of the embryo is checked, and the embryos which are normal, only the normal embryos are put back into your uterus. So quite often when we do the uterine check, when we also check the status of the embryo, we should be able to find out what could be the reason for your failed IVF. Sometimes some immunological causes can be the reasons. We need to check for that. Sometimes also there could be your blood could be thick, the blood is thick, the blood flow to the uterus and all is reduced. We also check for the blood clotting disorders if the woman is suffering from those. So if that is a reason, we can put them on some blood thinning medication to control that. So all of these are few of the cases, reasons behind the failed IVF. What we recommend is you need to come for an initial consultation with us, where we get all the reports from your previous failed cycles, where we can evaluate what is the underlying cause and accordingly we can correct it. So we have a number of patients in our experience. We recently had a patient who had 3 failed IVF cycles in another center. When she first visited us, we did the initial basic workup for her. So in the initial basic workup, what we recommended for the woman was she never had a hysteroscopy. She had 3 IVF cycles where good blastocysts were transferred into the uterus, but unfortunately she did not get pregnant. When we did the hysteroscopic evaluation for her, she had a lot of adhesions inside the uterus. Because of these adhesions, the space inside the uterus becomes restricted, and due to which the implantation of your embryo is affected. So once we did a hysteroscopy and releasing of the adhesions, the uterus became perfectly well. And then when we evaluated the husband's semen analysis was good, but the DNA fragmentation level was very high. So we put him on certain medications to improve the DNA fragmentation. After 3 months, when the couple was ready, they underwent a cycle of IVF with us, where we collected the eggs of the lady, put it together with the husband's sperm, developed them to the blastocyst stage of the embryo, and a single blastocyst was transferred into the uterus of this lady following the hysteroscopy and correction of adhesiolysis. And guess what? She was pregnant. So by proper evaluation of the couple, and to find out what could be the underlying reason for this failed IVF, we could give them a very successful pregnancy. Similarly, we have a large number of patients where we do a thorough evaluation and appropriately treat them according to the underlying cause, and that's when we can give you a good success. So if you have any of these concerns, you are free to approach us. We are located in Hyderabad. Anytime we can help you out. If you are out of the city, we can help you out with a video consultation to start with, and you can visit our center at a convenient time if you are comfortable and happy with our advice. If you are happy with this information which I have shared with you, you can subscribe for this channel, Medical Information Clear, and also share it with your friends and relatives. Thank you.